Hey there, viewers! Have you ever wondered if blood clots give warning signs like other body issues? A blood clot is a gelatinous clump formed when liquid blood thickens. Some blood clots can be life-threatening, and under no condition should they be left untreated. In today's video, we'll be discussing 7 silent symptoms of blood clots that often go undetected. Can your discolored skin, persistent back pain, and leg cramps hold any connection with blood clots? Should you worry about sweating excessively? What about warm skin? We're talking all that and more. Number 1. Discolored skin. Have you been seeing some discolored skin lately? It could be a sign of an underlying condition like blood clotting. Blood clots normally form when you are physically hurt and your body needs to stop the blood flow. However, experts say that sometimes they're formed in veins and arteries without any obvious sign of injury. It can lead to severe complications and can sometimes be fatal, particularly if it enters your brain or heart through the bloodstream. Blood clots have different symptoms depending on the body part they're located in. One of the most common symptoms is discolored skin. What happens is that the blood clot interferes with the normal flow of blood. This leads to discoloration of your skin where the clot is present. Certain areas of your skin will become paler or much redder. If your skin looks more red or pale in one leg or arm, it's probably due to a blood clot in your vein. A blood clot in the lung, also known as a pulmonary embolism, can occur if the clot from other body parts passes through the bloodstream and gets stuck in the blood vessels of the lungs. This can result in symptoms like pale, clammy, or bluish skin. There are many other health issues that show similar symptoms. It's also advised to consult a doctor before coming to any conclusion. Number 2. Cramps in legs. Do you feel like you're prone to leg cramps? Are they affecting your quality of life? Chances are high it could be a blood clot somewhere within your leg muscles. Complications due to blood clots occur depending on the body part they're in. Legs are often their favorite hiding spot. Leg cramps are episodes of sudden, uncomfortable pain in the leg muscles. Deep vein thrombosis, DVT, is a blood clot that forms in the leg or arm, but it mostly happens in lower limbs, i.e. leg and thigh. People with deep vein blood clots experience symptoms like cramps or persistent pain in one leg, so this might be a sign you need to take it seriously. Venous blood clots develop gradually, whereas an arterial blood clot occurs suddenly. Blood clots may be the result of staying in a cramped position. If you're bedridden or have had no leg movements for a really long time, you might develop a blood clot in the leg due to interrupted blood flow. Many people take leg cramps lightly and feel that with natural supplements and exercise it'll go away. However, if this is due to a blood clot, it won't go away until you pursue treatment. If you ignore leg cramps, there is a possibility your clot would break off and be disposed of in the bloodstream. Worse, it will travel to the lungs and cause pulmonary embolism, which may be fatal. Are you enjoying this list so far? Well, this next point will surely surprise you. But before we continue, why not subscribe to our channel for more videos like this and hit the bell icon so you're always up to date. Number 3. Warm skin. Is your skin at a higher temperature than usual? It's cool outside, but still you feel your skin is too warm. There could be several other reasons for this, but a blood clot is often among the top contenders. Warm skin is another common symptom of a blood clot. When the blood flow is disrupted, your body changes the temperature of that particular area. The difference in temperature at the site of the blood clot may be noticeable. Usually 3 symptoms of blood clots arise together. There are discoloration, cramps in the leg, and warm skin. If you have all of these, it might be wise to consult your healthcare provider, especially when you have a history of blood clots. Superficial blood clots are formed just below the surface of the skin. The part of your body where the blood clot is formed becomes swollen and warm to the touch. There are high chances that the skin would also become red, indicating discoloration. If you've been in a sitting position during long-distance flights or while recovering from surgery, do not ignore this. Number 4. Back pain. Back pain is one of the most common complaints people have. Pick up a heavy bag, there goes your back. Try a new yoga pose without supervision, there goes your back. But people often don't realize that this could be a sign of a blood clot. It might seem unlikely, but it can be a strong indicator of the presence of a blood clot in the pelvic area or in the IVC, inferior vena cava. IVC is the largest vein in our body and a major abdominal vein located at the posterior abdominal wall. Severe lower back pain can be an initial symptom of a blood clot in the IVC. A blood clot in the IVC or IVC thrombosis is most commonly caused by an unretrieved IVC filter. Another glaring sign could be severe lower back pain in a non-muscular spot. It indicates the presence of a blood clot. The pain is persistent and can't be reduced through any amount of stretching or massage. However, do note that pain in the lower back isn't usually caused by a blood clot. So if you're dealing with persistent back pain and trying to self-treat it, please stop. If it's caused by a blood clot and goes untreated, it can result in permanent damage by blocking blood to the extremities. Before we move ahead, here's a video you may like. Watch this video to find out about 11 foods that can potentially kill you. Number 5. Swelling. Swelling is another common symptom of a blood clot. This can happen in different body parts depending on the location. The most common sites of blood clot-generated swelling are your arms, hands, ankles, and legs. Blood circulates through veins and extremities and flows back to the heart. A clot in the deep vein blocks the smooth flow of blood to a particular arm or leg, preventing it from reaching the heart. That's how deep vein thrombosis causes acute pain and swelling in arms or legs. Valves in our veins are damaged after healing from these clots. Even after recovering completely from DVT, some people suffer post-thrombotic syndrome due to impaired blood flow. This leads to symptoms like chronic extremity swelling and pain. However tempted you may feel to treat persistent swelling at home with a hot and cold compress, please note that this persistent swelling is an indication that something is wrong, and there are high chances that a blood clot is hiding somewhere in your veins. Number 6. Shortness of breath. Shortness of breath is the primary symptom of pulmonary embolism. This is mainly caused by the clot that traveled via the bloodstream and got stuck in the blood vessels of the lung. Along with shortness of breath, you will experience chest pain and a rapid pulse. It'll get to the point where you may cough up blood and observe a sudden drop in blood pressure. The majority of blood clot-related deaths are caused by pulmonary embolism. Along with shortness of breath, a person suffering from pulmonary embolism might experience symptoms such as lightheadedness, irregular heartbeat, and coughing. PE is a life-threatening condition, so these symptoms can't be ignored under any circumstance. Although anyone can develop DVT and PE, health issues like chronic heart conditions, cancer, and paralysis can increase your chances of developing a blood clot. Number 7. Excessive sweating. Excessive sweating is another symptom that must not be ignored. Yes, some people sweat more than others, and it's normal. But if you develop this for no apparent reason, it could be a sign of an underlying condition like blood clots. Excessive sweating may be accompanied by other blood clot symptoms. It's a sign that the blood clot could be stuck in your lungs or your heart. This blood clot can obstruct an artery-nourishing part of the heart, which eventually can lead to death or cause permanent damage to the heart muscles. This can lead to a heart attack. If you are experiencing chest pain, irregular heartbeat, and nausea along with excessive sweating, call the ER immediately. Blood clots should never be left untreated. Have you noticed any of these silent blood clot symptoms? Let us know in the comments below. We would love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.